Sum it up for us. What is this? How bad is this bill, Congressman?
Well, this bill is pretty bad. I mean, it's worse than mean. It's cruel and it's deadly. And I don't say that lightly because I take death very seriously. As an emergency physician, I've seen death. I have pronounced people dead. I've tried my best, and sometimes I bring them back and I resuscitate them, and sometimes I have to tell their family members that despite everything that we can do, they have passed away. Let me tell you why this is deadly. Because you're going to have 20 million plus people that's going to be uninsured. That's on top of the already 50-something million that we already have. And when you don't have access to
So these are
healthcare,
20 million, if I can just interrupt you, who do have coverage under Obamacare, who are going to lose it, right?
Well, they haven't defined that yet. They just say that there's going to be 20 million more on top of what we have. So we're assuming that that's the case.
Yeah, right.
Nonetheless,
we haven't heard from the CBO yet. Right?
Nonetheless, when you hear from Republican members that not having access doesn't cause somebody to die or doesn't lead to death, there's physicians and nurses all over this country who can tell you that that's absolutely wrong. I told a story yesterday at this press conference where we had 100 doctors, medical students, nurses, people in white coats, providers out there from all over the nation, from California to the East Coast, who went up with Doctors for America and basically said that this bill, regardless if you're Republican or Democrat, patients are going to lose out, patients are going to suffer, and there's nobody who understands the frustrations of not having health care, the frustrations of not being able to get your medications more than the patient and their physician and their nurse, because they live it every single day. So this was a podium to allow physicians and nurses to have a voice to really talk about their patients. And I talked about a patient, a 55-year-old woman that I took care of in the emergency department. She came in with vaginal bleeding, hemorrhaging, very frightened, very afraid. We were able to stop the bleeding, and I fought tooth and nail to admit her to the hospital. She did not have health insurance. She didn't have health insurance throughout this time, so she never had her pap smears. So by the time we admitted her and diagnosed her, she had advanced cervical cancer. Despite the chemotherapy, despite the treatment, 6 months later, it was too advanced. She died. And that is a condition that could have been detected early, that could have been cured from removing the cervix while it was at its early stages, and she would have been alive. So not having health care leads to potentially death.
And on that particular point, as I understand it, this Senate bill allows states to opt out of providing essential services like cervical screening, mammograms, colonoscopies, or whatever, which are preventive measures, as you point out, right? Detect it, see a problem early, take care of it.
Exactly. So, you states can choose now whether they want to keep the guarantee of the essential health benefits, which are emergency care, maternity care, mental health. Included in that is the opioid addictive treatments,
right?
And pharmaceutical coverage, and all the preventative care that the Affordable Care Act guarantees patients to have. Now, states could choose to say we're no longer going to offer those if they implement a high-risk, high-cost, underfunded insurance pool for those people who have complicated chronic illnesses, which we know is going to be so underfunded that those premiums and those costs are going to go up so high that eventually they're going to price patients out of that market.